So moving on to Middle East respiratory syndrome, coronavirus, MERS-CoV. It's a respiratory illness similar to SARS, caused by a coronavirus. It first appeared in 2012 in Saudi Arabia, as you've heard in your lectures. The case fatality rate is 35%, which is actually much higher than SARS. SARS was about 12%. Okay, so this is more severe than SARS, but not as infectious. SARS had a reproductive number of about 2, MERS is about 1, so it's not that infectious. The source of infection really is unknown, probably camels, and person-to-person transmission has been documented in healthcare settings, similar to SARS. But it's nowhere near as, the epidemic potential is not as high as SARS. Bats may be a reservoir, but transmission from bats to humans has not been documented. So the signs and symptoms in the early stages are very non-specific. A non-specific respiratory syndrome with fever and cough, nasal congestion, some cases have diarrhea, and then in the advanced stages you get the SARI syndrome, severe pneumonia, multiple complications, organ failure, and death. There's no currently available vaccine or drug. The laboratory testing should be a nasopharyngeal swab, and if you can get lower respiratory tract infections, if the patient is intubated, for example, you should try and get lower respiratory tract secretions. A positive PCR is confirmatory. Case management is supportive. High-risk groups, people with chronic diseases and older age. The median age of infection is about 40 to 50 years. There tends to be a male predominance, and things like diabetes, chronic lung disease, renal disease are risk factors. The advice for cases suspected of having MERS is very general advice on infection control precautions. Control and prevention, really, there's nothing that specific unless you're in a hospital and there's a hospital outbreak, in which case hospital infection control and triage is really important, and I'll come to that. Currently there's over 2,000 cases globally, 35% case fatality rate, but more than 85% of these cases have occurred in the Kingdom of Saudi Arabia. All of the index cases of MERS all around the world have had a history of travel from the Middle East. So the source is in the Middle East. And there's a lot of cases where there's no information, or there's the risk factor for infection is unknown. These are all the countries that have had cases of MERS coronavirus. 27 countries. Oops. That's just a map showing you again that the epicenter is in the Kingdom of Saudi Arabia, as well as the Arabian Peninsula. Now we did a study looking at airline travel patterns, and we predicted the risk of a MERS coronavirus case occurring. We predicted the top 100 countries, and this is the top 50, and look at the country that's at top of the list at risk for a case of MERS coronavirus is India. Right? And the reason for that is, who knows the reason?
Big country with a lot of Muslim population,
Yeah. So if you didn't hear that, India has a large Muslim population. The Hajj pilgrimage and Umrah pilgrimage, etc., are a major risk factor for transmission of MERS coronavirus. In fact, any mass gathering, but there's been a lot of research done on Hajj pilgrimage, which shows that the risk of infectious disease outbreaks, whether it's meningitis or influenza or any other infection, is really high. So travel advice and travel vaccinations, really critical. Most countries have protocols for travel vaccinations for traveling to the Hajj. But it just means for you in the hospital where you work, if you've got someone with SARI, you must ask their travel history. If they've been to the Middle East, you must consider, could this be MERS coronavirus? If you don't, you'll end up with a situation like South Korea. So the red bar there is the outbreak in South Korea in Seoul, which happened in 2015. It's the single largest outbreak that has occurred outside of Saudi Arabia. So that outbreak started in May 2015, total of 186 cases, 36 deaths, a male predominance, average age 54, and hospital transmission. What happened was there was a 68-year-old businessman who had travelled extensively in the Middle East, including to Saudi Arabia. He returned back to Korea on the 4th of May. Initially he was asymptomatic, he didn't have any known risk factors, and then he started to get ill on the 11th of May. He made multiple visits to different healthcare facilities. You can see there on the right-hand side. He went to Asan Clinic, Pyeongtaek Hospital, 365 Clinic, and then the Samsung Medical Center, which is where he was diagnosed. So this guy with MERS coronavirus went to multiple healthcare facilities. Nobody made the diagnosis. It was a failure in hospital triage. And in this day and age, you know, we live in a very interconnected, globalized world. If there's an epidemic anywhere in the world, it can affect you because people travel and they can bring infections back. So he was finally diagnosed and treated, but this is the chain of transmission from that one case. 186 cases, mostly in the hospital, mostly healthcare workers. So if you fail in your triage, this is the kind of scenario you could be facing. This is just looking at the cases in Saudi Arabia. 45% had no risk factor that could be identified. 13% were healthcare required. 27% were patients in the healthcare setting, and 12% were household contacts. This is just showing you the epidemic curve of MERS coronavirus. And what's the most striking thing? So each colour is a different year, right? So the green is 2014, purple is 2015, blue is 2012, red is 2000. What's the most striking thing about the pattern?
Last 2014, 15 there are more cases and rest of the years.
Yes, that's correct. There's more cases in 2014 and 15. What else? There's actually no pattern, is there? There's no seasonality. It's not happening at the same time every year. It's happening at different times, which is really unusual. There's no predictable pattern. So I guess every healthcare facility should have triage protocols for travel-associated infections, whether it's measles or MERS coronavirus or Ebola. You know, you need awareness of what's going on in the world and have a protocol, clinical decision support system, so that you don't miss a case like this.